Canada's vaccine supply is expected to get a big boost this week with the first shipment of the AstraZeneca doses. On Friday, Health Canada approved that vaccine for people over the age of 18. Then late today, the committee that advises Health Canada on vaccines seemed to contradict that, recommending the AstraZeneca shot not be given to people over the age of 65. Abigail Bimman has been following the vaccine rollout for us. Abigail, this is going to be confusing for people. What more can you tell us?
Well, Donna, the new guidelines from the National Advisory Committee on Immunization cite limited information about its effectiveness in older people as the reason it's not recommending it be used in people 65 and over. Complicating things, the very same day, Public Health England released data from a real-world study showing the Oxford-AstraZeneca vaccine is, quote, highly effective in reducing infections among people 70 and older. And on Friday, Health Canada also cited real-world evidence showing this vaccine is effective in older people, especially at preventing severe disease and hospitalizations. But like with all NACI recommendations, it will be up to the provinces to decide what happens as seniors across the country start to get their first shots.
I can't wait to get back to my gym.
At 84, Gill Riviere is among those over 80 who got their first shots at one of several Montreal area clinics that opened Monday, itching for a normal life after a long year.
Our sons have been terrific, and they've helped us through all of this, and now they say, I can't wait to hug you. So I'll wait for another 14 days and I'll get my hug.
Mass interest in mass vaccinations means some challenges.
We did have a little bit of a hiccup today with one of our computer systems. It created maybe about a 10-minute delay, but we were ready with a old school, shall we say, paper version.
In Ontario, websites and phone lines overloaded as more public health units began to start vaccinations for those 80 or 85 and older. All the appointments in York Region fully booked before noon.
We were hours trying, and then you go, the website freezes. It's a disaster.
While in Toronto, no word on a start date.
As the largest city in the country, we have much more ground to cover.
Ontario is still 2 weeks away from launching its province-wide booking portal with a patchwork of plans across each local health unit.
There's no confusion. Some regions are opening up more quickly because they started earlier. They are more advanced in the priorities.
And in Manitoba, people 95 and over and Indigenous people 75 and over are also eligible for the shot.
They'll come back in 3 weeks and see me again?
While Ottawa is being tight-lipped about delivery dates for the AstraZeneca vaccine, Verity Pharmaceuticals tells Global News the first 500,000 doses will arrive here from India mid-week. But if that vaccine isn't going to be used on people 65 and older, it won't speed up the vaccine rollout for Canada's elderly. Donna?
All right, interesting, Abigail Bimman in Ottawa, thanks. So British Columbia has decided to extend the time between the first and second doses of the Moderna and Pfizer vaccines to 4 months. The aim is to get one dose into more people sooner, giving them at least some protection. It's part of phase 2 of the vaccine rollout in BC, focused on people over the age of 80. Robin Gill explains the plan.
How are you feeling today, Mom?
Good. This is as close to company as Shirley McDonald gets these days. A daily dose of her dutiful daughter to make sure Mum is safe.
I haven't liked it one bit because you're separated from your family and friends.
There's finally some relief for the 90-year-old. She's set to get the COVID-19 shot in the next 2 weeks.
I'm looking forward to being able, I think it's over a year since I've been in a store or in someone else's home.
Anyone 80 years or older will get their first shot mid-March. The same goes for First Nations people who are over the age of 65. But there's a new approach to the COVID-19 fight in BC. After consulting with the Federal Immunization Group and countries like the UK and Israel that are ahead of their vaccination schedule, BC will delay the second dose by 16 weeks.
The important thing that we have learned is that these vaccines work, they give a very high level of protection, and that protection lasts for many months.
That will push the timeline up for other age groups.
We will reach more of our population much more quickly with the extension of second doses and the other vaccines that are now getting approved and are going to become available.
The approval of a third vaccine, Oxford-AstraZeneca, which doesn't require special freezers, will allow the province to look at getting some people vaccinated earlier than expected. This would include police, firefighters, teachers, and those who work in processing plants, although a timeline isn't available yet.
We are working on how to, which of those are most at risk from infections and outbreaks, and we've seen a number of outbreaks in some of those settings.
The delay of the second shot doesn't bother Shirley McDonald, and she certainly won't let her guard down until she gets the second dose.
When the rest of the family are done, it'll be even bigger relief.
It'll allow her more visitors and more freedom, especially since this is as far as she's able to get out of her house, the driveway of her home. Robin Gill, Global News, Surrey, BC.